In this video, we are going to talk about CPT code 99204 for a new patient, moderate complexity using the medical decision-making model. So first we're going to look at the problem addressed. So with the 99204, the criteria requires that the patient has one or more chronic illnesses with exacerbation or progression, or one acute illness with symptomatic symptoms. Now, when we look at the data, we have to have at least a moderate amount of data to look over. So that would be multiple tests ordered, or independent historian, or a test that you have to interpret. And then lastly, the risk. We're looking at a moderate risk of complications, morbidity, or treatment decisions. So with that might be providing the patient with a prescription. So let's talk about an example of a clinical presentation for a note that meets criteria for 99204. So the patient might present for an initial evaluation due to worsening depression and anxiety. So say you have a 28-year-old female who comes in and reports a history of the last 6 months of having increased sadness, lack of motivation, and insomnia. And then recently they began missing work and isolating themselves from their family and friends. They report having some passive suicidal ideations with no current intent or plan. They also endorse having panic attacks 2 to 3 times a week, but denies any hallucinations or mania. So the past clinical history for this patient is significant because we've got depression and we've got anxiety. And the patient might have even had medications in the past for depression and anxiety. So at this time, the patient's not taking any medications, and the family history may be significant or may not be significant. And when I examine the patient, I've noticed that there's a depressed mood, their affect is restricted, their thought process is still goal directed. They've got some passive suicidal thoughts, but nothing active and no plan. And their judgment and insight is fair. So when I do my assessment and plan, I decide to initiate an antidepressant, maybe some venlafaxine. So I initiate venlafaxine 75 milligrams, and then I know that I want to see them back in 2 weeks. And I'm going to monitor them closely for side effects or increased SI or suicidal indications. I'm going to review a safety plan with them, and then for the anxiety, I'm going to start them on hydroxine, 25 milligrams as needed for acute anxiety. And I'm going to educate them about deep breathing and grounding techniques. And sleep, I'll ask them about sleep and insomnia and counsel them on sleep hygiene, especially when sleep is such a huge secondary symptom related to depression and anxiety. And then the labs, I might order a CBC, TSH, look at their vitamin D, and do a comprehensive metabolic panel, CMP. And then I might want to refer to a therapist, or I might want to just do some therapy while I'm there. And if I actually do at least 16 minutes of therapy, I can bill for another code for therapy, which we'll do in another video. So, and then I have them follow up in 2 weeks. So in this situation, I have met criteria for 99204. My problem that I addressed is 2 chronic conditions. That's depression and anxiety, and they're both worsening. The data that I reviewed is going to be the labs. And then I refer to a therapist. And then my risk is moderate, and I actually gave them prescriptions. So I'm going to do medication management. So as you can see, we have justification for a 99204.